Good evening and welcome to The Square. Tonight's discussion is on the recent COVID-19 guidelines. Many of you, I'm sure, have seen different guidelines coming out of the August 14 cabinet. And soon, a cabinet meeting, soon after, there were different guidelines by different institutions on preventive and response measures against the pandemic. Now, these have caused confusion in the public, and the purpose of the show tonight is to get clarification and understand the institutional coordination between the guidelines that have been coming from different institutions, whether it's rural, whether it's RDB, whether it's City of Kigali, or Ministry of Local Government. In addition to that, we're also going to look at the petition that was put forward by civil society organizations to government, requesting government to revise some of these guidelines. Joining us tonight, we have with us via phone the Permanent Secretary of the Ministry of Local Governments, Mr. Samuel Dusendyumva, Permanent Secretary, welcome to The Square. I hope you can hear us via phone. Okay, I think we'll come back to the Permanent Secretary. But we also have with us, joining us via Skype, Dr. Aflodis Kagaba, who is here representing civil society organizations. Dr. Kagaba, great to have you on the show.
Thank you so much for inviting us. Happy to.
Great to have you again. I think this is your second time on the show. If we can just quickly go back. Can we go back to and welcome the Permanent Secretary at the Ministry of Local Government, Samuel Dusendyumva. Are you with us?
Hello, good evening. I'm here.
Great. Good evening to have you. And very soon on our screens, we'll have your image. There we go, as well as your title. Thank you very much for joining the show. My name is Dan MPC, host of The Square. As always, I'm joined by my resident panelists of The Square, Charlie Haber. Great to have you on the show.
Same here, Dan. How are you?
Good.
Good.
We are also joined by Brenna Namata, resident panelist on The Square. Brenna, great to have you on the show.
Thank you, Dan.
You're so quiet. So different from how we were 5 minutes before the show began. So before we kick off, as we always do, just a few midweek highlights from The Square resident panelists. Highlights of news of the week that has caught their attention. And I'll start with you, Charles Haber. Is there anything you'd like to share?
I'm a very happy man, and I think we're progressing. You know, the beauty about Rwanda is that whether it's government or private sector or civil society, there's always an aim to improve, and I'll be very, very specific. It's about how police go about their business. I am one person who is very convinced that our police do a very fabulous job, and whenever they fall short and they are faulted where they have fallen short, they will find ways to make sure that they style up. For a while, we've spoken about it on The Square. It's been all over social media about the excessive use of force during policing COVID. Now, people might think that it is only restricted to policing COVID, but if you look at what has been going through social media and what have you, it's also gone beyond that, and how detainees are handled, for example, and the shooting of detainees, the shooting of people who are violating COVID guidelines, and you know, it was kind of being swept under the carpet. Last week, the Minister of Justice did come up to say that no, it's something that's going to be checked. A few days later, the President, during the press conference with RBA and the others, he did say it's something that's not institutionalized but individualized, and it's going to be looked into. Police themselves have come up to do a story in that regard, and I think it's very good. You know, I think there's a Kinyarwanda saying that is loosely translated that the best way to get cured from the disease is to admit that you are actually sick.
Absolutely.
Yes, and then you'll get cured. So I'm a happy man in that regard.
Yeah, I'm also very relieved to see Rwanda National Police saying we are looking into the matter, and the police who have been accused of brutality towards citizens are being investigated, and in due course, justice will take place in due course.
But can I also say just one more thing in that regard? The other thing that has made me happy is that there was a story in the New Times today to the effect that I think they were quoting the police spokesman that saying that even those who have been wronged, justice shall be served unto them. So, and I like to give an example of Rwanda Revenue Authority. Several years ago, RRA used to be very brutal with business people, and when they started losing cases, the business community would take them to court, and Rwanda Revenue Authority would lose cases. Fast forward, we started seeing them being a bit more friendly. So I hope people who have been either wrongfully arrested or wrongfully detained, for that matter, will start bringing the institution to book.
To book, yeah. Yes. Brenna, would you like to weigh in briefly?
Not on that.
Okay.
On the police.
Yes. Any highlights you'd like to share of the week so far?
I've been looking around for some positive news, some good news, and it's quite depressing actually what's happening. I don't know how other people manage, but for people in newsrooms, you struggle when it's all sad news around. Today we were following up on the story of this parent with a child with special needs, and she tells the frustration with COVID because her child requires special attention, and normally this would be provided at school, and life is just difficult. For me, it just reminds me of the many things that we take for granted. For many people, school is people go and sit and maybe there's a teacher in front of them and then they go back home. But for some parents, going to school is another life for their child. Yeah, so I don't know. This year is extremely difficult.
It is extremely difficult. But, there's no way but to just keep going.
Yeah.
There's no other option.
Yeah, hopefully, if we could delete 2020.
I personally have cancelled 2020. Anyway, back to our guests. Just very quickly, if we can hear from the Permanent Secretary, if he's here, because the first question is to him. If we could have him on the screens. Thank you for joining us, Mr. Dusenyumva. And the first question is really to understand institutional coordination. And before I proceed, I'd like to just ask our production crew to ensure that he's online. If I can hear from him, can you hear us?
Yes, I can hear you.
Great. So the first question is to do with institutional coordination. And, obviously these recent guidelines have reduced in some drastic measures, actually sterner measures following the August cabinet meeting. We've had curfew reduced to 7 p.m. And we also have higher violations, fines, for COVID-19 violators and that sort of thing. But obviously all this is in an effort, it's in a bid to curb the spread of the novel coronavirus. But what we want to ask you, coming from the Ministry of Local Government, one of the key stakeholders, implementing stakeholders in managing this pandemic on a government scale, is understanding the sort of confusion to the public regarding different directives or different guidelines, that have been coming from different institutions. We know that Rwanda Development Board released some guidelines around tourism. At the same time, the Rwanda Utility Regulatory Agency released some guidelines. Then we had City of Kigali releasing some more guidelines. These are to do with fines or travel advisory. But there's a sort of confusion to the general public. And we want you to share some insights on the level of institutional coordination and just any other information you have on these guidelines that keep on being churned out to the public, just to clarify for us what's going on, but especially from an angle of institutional coordination.
Thank you, Diana, for inviting us to the square again. The question you just asked is a very broad question, but there is one thing that is for sure. COVID is still at the door. We are still having positive cases. And in fact, before the cabinet meeting that you're referring to, We are having numbers shooting. We saw numbers going to 300 a day. We saw numbers really coming from 10, 20 to 200 in 5 days in a row. We saw number of deaths going up. It was really going very bad, and everybody can attest to that. So with that meeting that you're referring to, the government decided to put in place more measures that are aimed at really curbing that spread of the disease. So I think, first of all, there is no confusion, because it has been made clear that the role of each and every one of us is very simple. We need to stay away from COVID, and the way it is done, health institutions have clarified that role: washing hands, mask wearing, avoiding, ensuring social distancing, and then some other, things that can lead to people not abiding to that. So you refer to a number of institutions that came out and really tried to actually put more clarification on a number of areas, especially those that have to do with transport, those that have something to do with social gatherings, where more or additional measures were needed to ensure that there is no confusion, actually. So I think from the coordination perspective, the cabinet meeting was very clear and clarified the role of the local government, districts, and the grassroots level, and even encouraged them to do much more in terms of ensuring compliance with the guidelines, because there was, and we can all concur that there was really evidence that people were not abiding with the guidelines. We were seeing pictures on social media of people going to parties, heading with no social distancing at all, while the number were going up. So the cabinet meeting requested grassroots leaders, local government, with local security organs to join hands and try to increase on the compliance with the guidelines. Then a number of institutions that are specialized in a number of areas came out to provide additional clarification. You're talking about, you refer to Rwanda. Rwanda was trying to clarify about transport. You're talking about RDP was trying to clarify about events, social gatherings, to ensure that if they are to be done, because they were supposed to be limited to the minimum, if they are to be done, they are done in accordance with the guidelines that can ensure that no more spread of the virus can occur during those gatherings. So, and then there was the missing link of the sanctions, because the sanction is aimed at ensuring and dissuading people who are at a very low level of understanding not to engage into activities that can put at risk people's lives. So I think from our perspective, in fact, those institutions came out with additional clarifications, additional guidelines to actually clarify more what was general guidelines to ensure that they are compliant and they can have a result and outcome on the ground.
Thank you very much, PS. I think that was a comprehensive explanation. Of course, the purpose of being here tonight is to, debate and see if we can do better, as Charles said earlier on. Before we got to Dr. Kagaba, who is here, who is here begging to defer by the very reason of the petition that they've put forward on government rethinking some of these guidelines, I'd like to hear from the panelists. Resident panelists, Brenna, I'll start with you. Based on what the Permanent Secretary said, is there something you'd like to add or something you'd like to ask?
I think in principle, everybody agrees that measures have to be put in place and safety comes first. But I think the challenge for most people is how practical are some of these things. Because if we take the cabinet minutes, for instance, as an example, they come at midnight or early morning, you already planned an event, and you get to the venue and they say, where are
you going?
Yeah, and they say, where are the results? You're supposed to have the results per last night's cabinet minutes, And yeah, it's we understand the spirit, but I think sometimes the implementation makes makes it even difficult to get people to actually do what is required. Yeah, because like for the last 2 weeks, it's coming to 2 weeks now. Yeah. When they introduced the testing, now the principle under the testing is okay, because you need to test as many people as you can to know the situation and for disease control. That's very clear. But we have to be realistic. Most people, if you look at the cost, it's too expensive. You can't suddenly tell someone, oh, pay this amount. And, you know, if you have a wedding, to show up for a wedding, it's quite unrealistic. So I feel that the spirit, nobody disagrees with the spirit, yeah, but we have to be flexible in terms of implementation to at least allow room for people to prepare for these things. Otherwise, when you just tell people you show up tomorrow and you say you must have a test, then there are problems.
Of course. For me, when you say that, what brings to mind in terms of these cabinet meetings that come out at night and the next day, I remember the 7 p.m. curfew. It's been now it's almost comedic. Now it's actually almost funny because you see the chaos that's there, but obviously it's getting better. But I just thought to myself, maybe couldn't we have given people, at least 2 or 3 days to adjust, so, but it was announced the 7 days, 7 p.m., the traffic, the accidents, the people who went to the stadium. I mean, and I think it's extraordinary times call for extraordinary measures. I don't know, but for the next sort of directives that come out, I hope there's a sort of lag or timeline for people to adjust, even though it's 24 hours. I don't know if people got stuck in different provinces, traveling, and that sort of thing. But anyway, this is what we're here to debate, and what we're here to also discuss and look for solutions as a solution-oriented show. Charles, before we go to Dr. Kagaba, would you like to weigh in?
I think COVID-19 is guesswork.
It is.
Yes.
It really is.
And however you look at it, in the early days we were told, no, masks are only for medical people.
Exactly.
If you're a doctor, if you're meeting a patient, that's only when you should wear a mask. Fast forward, if you don't wear a mask, it is close to a death sentence. Then we are told, no, social distancing, you must sit 1.5 meters apart and blah, 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 blah. But people move around while hugging each other on motors. Then you look at things like access to public facilities, write your names in a book and exchange pens and all that stuff. And there's just no way whatsoever you have a way of policing that somebody has written their real names or put in their phone numbers and what have you. When it comes even to medication, they tell you, the right way to, keep away from this, eat a lot of ginger, don't... smoke if you're a non-smoker. Then you look at your neighbors who will tell you that let the body build its immunity and you'll be fine. And I'm not so sure you can hide hundreds of deaths. You can hide probably their tens, but so there's something that our neighbors are probably getting right or getting so wrong that it's a shame. So I think there's a lot of guesswork. Now, that said, I do not envy at all people who are in positions of responsibility in Rwanda, especially local government leaders, or better still, law enforcement officers, because it's a very tough job to do, because when you look at the number of cases that were spiking over the last few days, it's been a bit of a dilemma. There's a decrease in the number of cases. There's an increase in the number of recoveries, but you're having almost, even just today we had one more death. So there's a spike. We're hitting 21 now, if my memory serves me right. So it's a very delicate balance. Yeah,
absolutely, it is. So I'd just like us to read just a couple of tweets before we go to Dr. Kagaba. And these tweets are more or less echoing what I think we're going to discuss here. And the first tweet that we have on our screen is from Mike. Mike says that thanks, the Square. We also expect more views on having a common understanding amongst agencies and the general public as well, while implementing some of the guidelines, because to some extent contradictions arise. And the next tweets that we have, and of course this is what he's talking about, echoing what you're saying, and Charles Brenner, in terms of the different understanding or perceptions of these guidelines. The next tweet is from someone called Mutoni Mary, and Mary states that I agree with the civil society's position that the majority of ordinary Rwandans cannot afford $50 for COVID-19 testing in order to attend a wedding. I am of the view that the fees are removed or paid by government. Okay, that's a bit extreme, but thank you for your views, Mary. Dr. Kagaba, you're here because you're representing civil society, and you cited a number of reasons in the petition to government that need to be rethought or need to be revised. You said some of the fines, the 13 signatories of this petition said some of the fines were too heavy, as well as saying that there was a sort of lack of institutional coordination and therefore not a strong uptake in terms of understanding and implementing these guidelines by the public. So what key recommendations, if you can briefly tell us, obviously we don't have time to go over the entire document, what key recommendations did the petition put forward to government for government to rethink or revise?
Thank you so much, Diana. As you saw, we did a petition and write a letter to the Prime Minister because we were concerned. Most of the issues you've already talked about them. Issues of the confusion around clarity and who does the institution that puts in place additional guidelines. And I will just give an example before I go to the recommendations. When Rura, the next day after the cabinet resolution, tweets that private transport does not include a tax, a cab, so motors. It's a bit, you're like, now what is private transport? It needs to be well defined. When you see the additional guidelines by RDB requiring people to have a mandatory test for meetings. Before you go to an event, you have to have a test of COVID. This is not in the cabinet resolution. And you're like, oh my God, the additional guidelines seem to be tougher than the main body of the guidance, which is the cabinet resolution. And that's why we were concerned that maybe we need really to say something about this, the importance of consultations, coordination, so that we can have a clear understanding. And also, people who are going to implement the guidelines, who should comply, get time to understand what does it mean. Can I go ahead and organize an event, or this is not possible, or this is possible? Now, we did raise a number of issues, as you say, including the cost. Some of the fines are really heavy. When you say, if you look at the city of Kigali fines, when you see the $50 for the test of COVID, if you ask someone who is organizing a wedding for 30 people to have all the 30 people tested before they could come to the wedding reception, it's going to be a huge budget that can be afforded by only a few of us. So we did put some key recommendations. One of them, of course, is around coordination, improving coordination, and ensuring that there is a very clear link between cabinet resolutions and the additional guidelines, and also ensuring that people get time to understand them so that they can be able to comply. We also did ask some repeating of some guidelines. For example, the test for COVID for special events, which are again not well defined. It has now turned out like all meetings cannot take place without a test if they are taking place in a hotel. We did ask for repealing of the Kigali City fines, because we believe that COVID-19 is a global health issue. It's a national concern. If we start allowing institutions, districts to put their own guidelines on fines, and we have Kigali City guidelines. Maybe next time we have Musanze putting in fines, and the other day it will be Rusizi and maybe some sectors. We are concerned that the people who are going to bear the responsibility to pay these fines, we may find some differences. Our recommendation was that we are not against fines, but let's have a comprehensive order that goes through a competent institution that puts fines for everybody across the country, so that we don't have fines that are heavier in Kigali and other fines that are very different in another district. So that was one of the recommendations again. We did ask for engagement. We understand, of course, COVID is there. It's a huge challenge. And as Haba said, we've been, of course, also changing our messaging. We believe that there should be some consultation. Private sector, we need to have the private sector on board. We need to have civil society. We need also to put more emphasis on education. On education, we are very concerned with all these guidelines coming up. We are very concerned with the issue of human rights. Some of the human rights may be violated. We are seeing an increase in some ungazetted places of detention. We have a number of schools that have become detention centers. It doesn't matter whether it is for 24 hours or 3 days. Who is monitoring these detention centers? What is happening there? So how do we ensure that human rights are not abused? Of course, I'm trying to avoid the extreme situation where someone is shot because maybe he's escaping or because of COVID. But we need this one to be clearly monitored so that we don't have anyone. When we look at the guidelines of Kigali City, you do find that if someone cannot pay a fine, they can detain you for 24 hours. They can put you in a special place. But how is this special place defined, and how is it managed to ensure that we don't experience any human rights abuses? We are also very much concerned, and we did raise it, the issue of private sector. I mean, if you move around now, these past 2 weeks, after the new guidelines and have started being implemented, all hotels now are empty. If you talk to the private sector, the private sector started coming up, starting to organize itself. But now everything has almost stopped. So I think as much as we are putting all the effort in fighting COVID, we also have to stay alive. We need to know that business has to continue. People have to stay healthy. Everyone is concerned, and we need to work together to ensure that all the guidelines are respected. But the guidelines also have to be considerate. They have to be guidelines that can be affordable. If you just put high amounts that no one can pay, it becomes very difficult, especially when this person cannot pay the fine. What happens next? Are they going to be prison? Are they going to be in prison for some time? What does it mean on their already struggling economic status? Yeah, this is why these are some of the recommendations I've put forward, and why we really thought that as civil society organizations that should represent people that are seeing it, and also stakeholders, we should come out and say this is what we are seeing and petition the Prime Minister. Yeah.
Thank you very much, Dr. Kagaba. If we can go just quickly to the Permanent Secretary. Earlier on you said these measures are stringent because there was a sort of laxity. People had started relaxing in terms of how we were managing this pandemic, even when it came to personal responsibility. So based on what Dr. Kagaba has said, PS Dusenyumba, what is your response to some of the salient points he raised in terms of what was put forward in the petition?
Thank you, Dan. I think what we are seeing on the ground is the number of positive cases per day are going down. We are seeing that our fellow citizens are complying with the guidelines. We are seeing less and less people being caught walking after the curfew, those who are caught in bars, illegal bars, and illegal social gatherings. So there is really a very good momentum, and we appreciate the contribution and the collaboration of the citizens. So coming back to what my brother, Dr. Kagaba, was just saying, I think, first of all, we have, last time I checked, we were having more than 1,500 NGOs and civil society organizations in this country. I do not believe 13 organizations may represent a position of civil society. That's my first thing. The second, I think there is a misunderstanding on how local government institution works. Because if you look at the law establishing the city of Kigali, you look at the law establishing the centralized entities, they have the powers to establish administrative fines. And these two organizations, the city of Kigali and the districts, are governed by different laws. So you can't have a blanket kind of, the administrative fines for the city of Kigali and districts, because districts are independent in themselves, so they may be having different decisions according to the realities of the ground. And these decisions are of the powers of the district councils. So that is the clarification I was trying to say, to put forward. Another thing is, I think we should put the lives of Rwandans forward. For every decision that is being made, for every advocacy that's being made, I think we should all concur that all these decisions were put in place to save lives. And as you can see, if you see the number of positive cases dropping, we are definitely going to see the number of deaths going down. And that is what everybody wants. Of course, we may find other ways of economic recovery. I'm sure institutions are working tirelessly on that, trying to put back business in order and things like those. But we should not really bring a conversation at this position, at this stage, at this particular time, where things are trying to pick a momentum of this kind of linguistic conversation, because we know, I think the citizens are getting to understand what we need to do. We need to ensure that we do not spread the COVID-19, because the effects are actually disastrous. Because you have seen, in the beginning we didn't have many deaths. Now we are having a number of deaths on a daily basis. So we need to do whatever it takes. And as you can see, the measures that were taken by the government are working. So what we are advocating for, and we are appreciating a number of civil society organizations, very many of them who have been supportive, who have been doing campaigns across the districts, who have been helping on the radios, trying to push and help the government in implementing these guidelines, trying to sensitize and put in place hand washing stations on the market, trying to distribute even masks. I think this is the kind of contribution that really would help to make a difference to the situations. Thank you.
Thank you very much, PS. I'd like to hear from Charles and Brenna. But one thing that struck me that you said is that, there are over 1,500 CSOs, and you're not sure if this petition was representative of all 1,500 of them across the country. Charles, what do you have to say to that?
I'm hoping that the PS will retract that, because there is no way you can make an attempt at downplaying the importance of what was communicated simply because it was communicated by people whom you don't think are representative of the others. I ask myself, if a huge influencer, and this is the part of the conversation that has been going around over the last few days around social media influencers, assuming one of the leading social media influencers in Rwanda got those recommendations that the civil society organization put up, owned them, and tagged the president, would the PS be saying what he has just been saying? I don't think so. So I think we should give due consideration to what is in the content of the letter, and not necessarily who wrote it. Let's just assume it was written by whoever wrote it, or some association of farmers in Gasarenda, and they are raising these pertinent issues. So for him to downplay it to that extent, I have a problem with that.
But just very quickly, and not really in his defense, but I also kind of understand where the PS was coming from. I think, for me, the way I understood it was more like it's not that they're not representative per se, but it's also saying that within the CSO sector, within civil society organizations, there may be quite a lot of them who have a differing view and would not like to be umbrellaed or put under that same umbrella as the rest. That level of difference is something that should also come to the fore and be recognized. I felt that's what he was trying to put forward.
Even if that is what he was trying to say.
Not trying to negate the issues.
He should not negate. I think that's how it came out.
Yeah, I think that's how it came out.
It came out as if he was trying to negate the issues, and I have a problem with that. But I want to go back to the meat of the issue, which is really around miscommunication or lack of the coordination in the communication. And I'll give an example of the local administration units, Umurenje, it's a sector level, or Akagari cell level, where the PS's boss minister says no bars should operate. Now the interpretation, it's lost so much in translation. By the time it gets to the executive secretary of the cell, he interprets it as no alcohol should be served. I am in the property management business. The other day we got a visit from people from the sector, and they told us that if we see any alcohol being served in this shopping center, we will come and close the building.
Wow. Even if there are other tenants that
Yes.
are not in the hospitality.
I know of a lady who runs probably one of the most popular restaurants in Kigali who was told that should we find anybody having their meal and they are having alcohol, we will close your restaurant. And these two communiques, these two people who actually went to the premises had one thing in common. They said that we do not care what RDB has written. We do not go by RDB's regulations. So then you ask yourself, do these guys work for the same government?
But RDB's regulation was that you have to have a meal if you're going to have...
You are allowed.
You are allowed,
yes,
exactly.
you are allowed
but,
to.
But
yes,
what you're saying is that
yes.
for them they said absolutely...
Yes, and RDB's regulation was actually it was more clear than that. It said bars in restaurants, yes, bars in hotels are not allowed.
Yeah, which makes sense.
Yes, and then you ask yourself, you know, who are we listening to? And it is very easy to hide under the cover of saying we're trying to fight COVID, and you hoodwink people so that they don't look at the fact that the same government institutions are not speaking the same language. You're doing no. Don't look at the fact that we're not speaking the same language. Look at the fact that COVID cases are increasing. I think that's intellectual laziness. Yes.
Berna?
I think to their credit, if you look at the previous 3 weeks, the cases have been kind of dropping.
As the PS said.
Yes. So to their credit, there's evidence that the measures are working. But that doesn't take away, again, issues around communication. One, when it comes to implementation. So I don't know whether it's an issue of translation but when it comes to...
You actually raise a very good point. It might be an issue of translation.
Yeah, implementation.
From one language to another, and
yes.
then things get lost.
Yes,
you know?
Things get lost because I had an exchange with someone who thought alcohol was banned. I said, no, as far as I know, there's no ban on alcohol. The difference is in where you drink the alcohol. You know, you can go to the supermarket and buy your crate and take it home. You'll drink your alcohol. So alcohol is not banned. But what they don't expect you to do is to go to a bar.
Exactly.
You know, or operate a bar anywhere. Yeah. You know, that's different from buying alcohol and drinking alcohol. I could drink the alcohol in my car and I would be just fine. Yeah. So the detail of implementation, I think, is quite problematic. Let's take it to the hotels. You tell people that they should show up with tests, including, for instance, if you have a wedding, you're saying people who are coming to decorate must show up at the venue with...
You know, I hadn't thought about that. In my head, it was just guests. I didn't think
No. Yes.
I didn't think about the service providers as well.
Yeah, the service providers. You know, service providers must show up with COVID tests. And remember, weddings, people have planned for a month or so, and then they have 2 days to the event, and you're coming up with service providers must also show up with tests. That's the interpretation. And people are losing money. Yeah, they're losing money because if, for instance, you've planned your wedding and it's 30 people, and then you wake up, you've already made a booking. The hotel will probably not give you the money, you know. They would simply say, show up with the results, you know, with the test. So I think we need to spend more time, whoever is in charge, understanding and trying to map out what the decision actually means for the different stakeholders and players.
Yeah. Thank you very much. Now, we've raised all these issues. We've raised, you know, elements whereby there's, you know, discrepancy between institutions. They should be speaking one language. Charles just called it intellectual laziness. Brenna, you know, you're pointing out that the costs of managing this pandemic are really being felt by citizens, especially when it comes, you know, when it comes to personal the personal decisions and personal events in their lives. Can we have solutions now? And I'd like to start with you, PS. One, because I think that comment, I feel like you deserve a chance to explain yourself regarding what you said earlier on to the effect of the representation of civil society organizations and the petition. If you can start with that and also just provide a way forward in sort of our closing remarks as we come towards the end of the show. PS, over to you.
Thank you, Dan. I think you put it very right. Maybe my English betrayed me, but I really was trying to say that there's a big part of NGOs that are really supportive of what you're trying to do. They're part of it, and most of these decisions and guidelines have been discussed with so many stakeholders. All these decisions, like the city of Kigali discussed with business owners, even these shopping malls, market owners, business operators, to ensure that we can really get all the contributions of each and everyone so that these guidelines are contributing to curbing the spread of COVID. So we really welcome any input, and we stand to be corrected. We're not perfect. You know, when you're implementing, you can have some hiccups, but we stand to be corrected, and we are very honest and open to receive all this constructive criticism. So about what we should be doing moving forward, I think, like Bana was saying, we are seeing that this compliance, when the compliance goes up, the number goes down. So I think we should really encourage our citizens, all of us, together to keep on complying with the guidelines, to ensure social distancing, because, you know, there are people who have been infected in meetings. There are people who have actually been traced, their contacts were traced to weddings, contributed to the number that we saw shooting. Of course, a big part was the market, and there was a press. So we can work together to ensure that can open to that. Second, I think for this social, if you have to plan a social gathering, guidelines were for 2 weeks. Of the virus. Other than that, I think I appreciate a lot of the citizens. They have understood, and we appreciate a lot of the grassroots leaders. Chuck mentioned it. It's very difficult. They work there at night. You see them at night trying to see people back home. You see them on the market trying to ensure that when we go to shop, we can keep the distance. We appreciate their contribution, and if we can all work together, we will bring this virus down. Thank you.
Thank you very much. And I really like what you said earlier on, that really our priority as government, first and foremost, is to save lives. And I think across government in Rwanda, that's a big, big deal for us. And I thank you very much for, just successfully putting it very forward, very clearly, and also explaining yourself regarding the comments and CSOs. If we can go to Dr. Kagaba, solution, way forward. PS is very open to constructive criticism, as you saw him mentioning, and is open to, understanding where they can correct, where they go wrong. So in terms of your solutions on moving forward regarding guidelines and directives that are there to save lives, but also put in context how they impact ordinary Rwandan citizens.
Yeah, thank you so much, Diana and PS. Of course, this is a conversation that should happen. And one thing we must highlight is that our country has done so far very well. And then we're one of the few countries, and it's because, of course, the government has taken a very good leadership in fighting COVID. Some of these guidelines, of course, they have to be implemented by the citizen. So any confusion that would happen at the citizen's level would make even compliance not go as fast as we want it. Of course, I would be happy when cases are going down and also we have very few cases of people who are going to the detention centers, people who are going to the stadium. If the number, actually the day we'll have no one going to the stadium and no new cases, we'll be doing quite very well, because we have to invest a lot in educating people. And of course, as civil society also, we must play our role and continue to educate people, to work together with the government. We are very much interested, and I mean, moving forward, there are things that also require some evidence to see how do we work, how do we ensure that people understand that COVID is still there. We are living with it, and we have to protect ourselves for the interest of protecting each other, but also at the same time ensure that no one becomes a victim of any other abuse. And that's why we are saying that as we move forward with compliance and implementing the measures, we also need to look at other things. We need to ensure that what is happening here, how do we educate people to make sure that they understand that they have to comply? How do we ensure compliance? But at the same time, it doesn't take anything if we thought even beyond 2 weeks and establish, especially when it comes to fines. Fines, this is a national, we still believe that COVID is in Kigali, COVID is going to go in Musanze tomorrow, it's already in Musanze. We can think about a bigger order that defines fines, and people can get time to understand fines. They understand the law that goes through the process. Because what is happening now, though we are yet to see, of course, do more monitoring and get cases, some people are interpreting and enforcing. Today I was in a hotel, just the same thing you were discussing, where they told me no alcohol, whether you are eating or not. And I've been seeing a lot of communication saying that no, if you're having lunch, if you're having food, you can have alcohol. But this hotel, and it's one of the big hotels, a 3-star hotel, has understood that in this period, you can't serve any alcohol by whatever means. So it shows that people haven't really internalized, and I think we need to do more about this. As civil society, I do understand that we have to engage. We are so many civil society organizations, and actually these that have signed are part of the few that are also doing a lot of work in terms of raising awareness and also responding. And we are already engaging in different sectors, and we want to continue, of course, to ensure that as we continue to fight COVID and protect ourselves, ensure that we have a health population, we are at the same time making it easier for the citizens to comply. And I think that's my take. So we have to do a lot of moving forward. I think as we implement guidelines, we have also to invest a lot in education. And I think this calls, of course, beyond, it has to be the role of government, civil society, every stakeholder, so that people get to understand and implement from the understanding than fear of the fines or of going to the stadium.
Absolutely.
Yeah, thank you.
I really like that point. It should be informative-based than fear-based when people actually comply, because it's more sustainable and it's more impactful. I'd like us to go to our tweets just before I hear, closing remarks as well from the Square's resident panelists. And the first tweet we have is from Richard, a frequent commentator on the Square, who says that the economic impacts of the pandemic will continue to be felt. Basically, people are broke and uncertainty looms for those I don't know how long. How does government enforce these measures reasonably in a way that the economy is not hit hard? Liaise with businesses in the future. That's his quick recommendation, liaise with businesses in the future. We have another tweet from Edmond Kagire, where he states that globally, there has been a conversation around the excessive power COVID-19 has handed back to governments, making them questionable because the pandemic business is exclusively government business. I would like to hear what the panelists have to say on this. We have 4 more tweets that I would like us to also just quickly look through before Charles and Brenner answer. And then we have a tweet from Annette, who was also recently on the show a couple of weeks back. And she asks that even the widespread consultations of different sectors of the population before putting in place some guidelines, for example, fines, how is this going to be done more during the crisis? I would like Charles and Bernard to quickly, if you have some responses, and I'll start with you, Brenna, before we go back to our tweets, but generally also your take on the conversation we've had tonight and your ideas on the way forward.
I think I totally agree with Dr. Kagaba. You need voluntary compliance because it's less costly. You know, if you have to keep forcing people to do things, then there's a problem. It's costly, and there are all other administrative issues and risks. Yeah, so it's always important that you raise the awareness and people understand why it is important that they do the right thing. On Edmund's tweet about and I some governments that were irrelevant, and then suddenly you have the pandemic. Different levels have look at countries, at the airport, Rwanda. I mean, no study has been done yet, and even the journalists. Government. There are some governments. We are beginning to see most governments are seeing we see is governments.
Citizens.
Yeah, social unrest. Yeah, so.
A few minutes left, but
should we really be seeing to Akajera or New I will forego that decision to one of these dedicated proper tour vans. They are not checked in the 30 or 50% rule does not apply to them. So you know, that's just one example. So we need more consistency. If and I like the best example I always want to give is of motors.
Social distancing,
yes,
and yet you have people
it's
less than a meter, less than 2 centimeters.
It's self-defeating that you're telling people in church who have come on motors to sit 50 kilometers apart, and then after the service they go back on their motors. I think, yeah, we need a little bit of consistency.
Totally agree.
By the way, even the 1 meter is being challenged. There's research challenging the effectiveness of the 1 meter.
But like Charles said, COVID-19 is guesswork.
It's guesswork.
It's really
not guesswork. It's not guesswork. I wouldn't say that. It's evolving.
It's evolving, exactly.
Yeah,
not guesswork, but
evolving.
it's evolving. Yeah. But it's problematic for sure. I'd like to thank our guests. Permanent Secretary Samuel Dusenyumba, thank you so much for joining the show, as well as to Dr. Aphrodis Kagaba. Second time on the square, always a pleasure having you. Thank you very much. To Charles and Berna, great to have you as always. To our partners, Uzi Collections and Bourbon Coffee, thank you very much for always supporting the square. And most importantly to our viewers, thank you for tuning in, especially those giving their ideas and thoughts and comments on social media. Keep the conversation going using hashtag the square RW. Thank you for tuning in. Have a good night and see you again next time.